This is Matt from MGMT Boston. We are in downtown Boston today with Jazmine, the co-founder and chief of staff of Quilt Health. So Jazmine, what are you and your team building?
We are building a software solution that ideally bridges the gap between research and care for patients, providers, and manufacturers really trying to make a difference for complex conditions. And we're focused first in sickle cell.
Now, this is a great healthcare town and a great health tech town. So what is going on in your startup today? As we enter the fall, what are you and your team excited about?
What is not going on? We are really excited about some of our first users and customers, getting some of our first relationships going with hospitals, health systems, some of the providers that we've honestly been connected to for the past year and a half through the National Alliance of Sickle Cell Centers. We're growing a lot and we'll probably have a similar growth spurt across functions. So really trying to be smart about bringing people on almost ahead of the real pinch, but also feeling enough of the pinch to know how to do that in a smart way.
Yeah, and as the chief of staff, tell us what you're responsible for, and then what have you learned building this company, working in healthcare, and holding other roles in your career that you would pass back to other operators and builders in Boston?
So I would say the role of chief of staff changes hour to hour, sometimes at least day to day. You can imagine when we were a much smaller team, holding some of the functions that now have a person that's actually holding them. So early on, as you can imagine, it was Andy, our founder and CEO, and me, and so we were kind of tag teaming across functions, whether that was early product exploration, marketing, getting partnerships off the ground. So that was kind of, divide and conquer, whereas now we get to be more and more focused. And so another part of my role is really thinking about how we dedicate our resources in terms of being able to focus as we grow. And that really looks different now than it did in January, and it'll probably look very different even as early as December.
Yeah, and what have you learned building this company that you would highlight?
I've learned that it's really important to plan for a future that's further out while holding really tight to the moment.
Yeah.
Even thinking in 3 to 6 month increments, you really protect yourself from being too short-sighted by picking your head up from time to time and talking to users, talking to customers, but also focusing on what you know that's right in front of you and moving the company that way. So really keeping a good handle on what we do know in the moment and acting on it, and not letting the more general ambiguity slow us down.
Definitely. And last but not least, whether it's other operators in Boston, builders, other members of the health tech community, how can we help Quilt Health grow here and beyond?
Well, I would say Boston is, a small city, as we say, and it's because relationships are so important. So, of course, if there are relationships, whether they're with manufacturers, whether they're with patients, healthcare providers, anyone in those categories that you think might be meaningful, we are open. We are really trying to listen a lot as we grow right now. And so any relationships that you think might be meaningful, we are open to. And also any ways that we can share just in terms of what we're developing. So any companies that might be in a complementary space or solving a complementary problem, we're really interested in collaborating and helping one another along as we really try to make a difference in healthcare that goes beyond, lip service.
Absolutely. This is Jazmine from Quilt Health, Matt from MGMT Boston, in this episode of Lantern. Thank you so much for joining us.
Thank you.